Hello students, my name is Liz Attia and today's topic is sanctity of life. Okay, so sanctity of life. So when we actually talk about ethical considerations in healthcare, there's some really big questions that our mind turns to. We talk about what the value of life is. When is life not valuable? So the sanctity of life and the futility of life. Who makes a decision about the value of life? When is it appropriate to end a life or to let a life end? These are really sort of important, critical considerations to consider in healthcare practice. The sanctity of life argument is that it's morally prohibited to intentionally kill a person, intentionally let a person die or make decisions that would shorten a person's life. So under this sanctity of life argument, life is a gift, and anything that we can do to prolong life, even for a minute or an hour or a day, is necessary, and it's incumbent on us as health professionals to bring to our professional client relationship. I guess only you can answer these questions as to whether you agree with that argument or not. But I'd ask you to consider in terms of the ethical theory, for example, just to case in point, would rule deontologists, would consequentialists, would principle-based ethicists, what would be some of the ethical theories that would go either to supporting or to disproving or arguing against the sanctity of life argument? Okay, sanctity of life, is it just? Well, Plato would actually say that any treatment that left a patient with a useless life was in fact inappropriate. So medicine was not intended for those types of patients, and they should not be treated even if they are wealthy. Now, he mentions wealthy because at the time that he was writing, wealth was actually considered to be a marker of success and added value to that life. But Plato actually says, well, really, if you're useless, then what's the point? And medicine was never intended to prolong those sorts of existences. But I guess the converse of that would be, well, how do you know with any scientific certainty that there won't be other discoveries or advancements to render, even if you were to accept this idea of a useful or a useless life, even though that is fraught with difficulties in terms of, well, how do you define that? And what does that actually mean? And what does that look like in practical terms? But how do you know that that won't change? I guess that's the point there. How do you know that there won't be new discoveries which will actually render the person's life useful again, even if you were able to define what that looks like? The converse of that is obviously this idea of futility of life. So the futility of life argument posits that really the burden of therapy is seen to be out of proportion with any possible benefits, then therapy should not be provided. So if you're supporting life for supporting life's sake without actually being of value, then really we're doing more harm than good based on that principle of non-maleficence. Supporters of futility of life argument would actually say patients should not be entitled to care that is judged to be futile, and doctors should not be obliged to provide such care. But then you raise the questions, well, really, who should be the ones to make this decision? If you go back to the principle of, liberalism, who are the power brokers here? Who are postmodernist thinking, who are the power brokers here? Who are the ones who actually make those decisions? Should it be the experts? Should it actually be the family? How can we actually then make sure that the intention for withholding the treatment is really in the interests of the patient and not some other extraneous information or extraneous influences that are driving this decision? And really, what measurements should we be putting into place here to gauge what's futile and what's not? Who is the decision maker here, and what kind of power do they have, and should they legitimately be given that power? So others argue we should make judgments based on quality of life. So, you know, the abortion of a fetus based on testing, for example. But like I said, how do we judge quality of life? Many people who are disabled would actually say that they have a good quality of life. What's the cut-off point? What's this arbitrary notch that we actually then say, well, this is useful and this is fruitful, but this is not. This becomes futile. And, you know, is there really any objectivity in that? Or is it just some subjective standard that becomes this line drawn in the sand to help us make a determination about what's acceptable and what's not? You know, is the age of futility 80, and then what if you're 82 or you're 79? It becomes an arbitrary line that's given meaning, but in fact it has no meaning because there's a range of other considerations. Thank you, students. That brings today's topic to an end.